All right. Go
Okay,
ahead,
I'll get
Mike.
serious. All righty. So good evening, everybody. Thanks for attending the training class for bulk transportation. This company is located out in Walnut, and they are hazardous materials transport company. They have trucks that drive with those big tanks, and you don't want to drink the stuff that's in their tanks because it's not milk. So nice company, really sweet people. I've met with them twice. The broker is Gallagher, and if all of you remember SGB NIA, and then Gallagher purchased SGB NIA out in Woodland Hills. This is from Jonathan Monroe and Eddie Chavez, Eduardo Chavez, Eddie, so it's their group. This is going to be a core enrollment. Andrea's going to walk you through everything. Eddie's going to be schooling us on their benefits. And it's going to be both face-to-face and call center. Everybody that's in Walnut, in the location there, whether they're in the office or in the areas around the office, they've got some big buildings there and people that work in them, and I think they do maintenance and cleaning and things like that. Everybody in Walnut is going to meet face-to-face with benefit counselors, and that's about 40 people. And then the balance, which is about, I'm going to say roughly 80 or 90, they're located in other locations or terminals, as they say. And so they either work in the terminals or they're drivers. All of those folks are going to be enrolling via call center. And this is a required phone call, just like it's a required face-to-face visit with a benefit counselor in the Walnut location. So open enrollment is going to run from the 1st through the 7th, tomorrow morning through the 7th. That's the public open enrollment closure date, December 7. There is a private, employees are not to know, close to open enrollment, and that's the 9th. We added those 2 days, so if there are stragglers or people that didn't get it done and we need to help them, we're not going to close the database until the 9th. But to any employee who calls you or asks you when the last day of open enrollment is, your answer is the 7th. One of the things that I wanted to address real quick, and then I'm going to turn this over to Andrea, and then she'll guide the rest of the call, is the employer has asked us to make sure that employees understand that they can post-tax pay the premiums on their medical plans, dental and vision. Now that's antithetical to what we preach every day, and that's why I wanted to address it, because it's not what we do every day. So I want to walk everybody through how I want this addressed with the employees, so we meet our obligations to the client, while at the same time make sure that we don't leave the employee short on the accurate information about the pros and cons of pre-taxing and post-taxing the premiums on their medical, dental, and vision plans. So the way I'd like you to address it is that, and it's anywhere in your process of the enrollment, but I'd want to make sure that every employee is spoken with about the pre-tax and post-tax process. So just doesn't matter when in the process you do it, just make sure you get it done, because we want to make sure that the one you forget is not the one that gets questioned by the employer to find out if we address these things and others, and then they don't say anything, they say, we know we didn't do it. So make sure you have this on your list of, we call them must-errs. Tell the employee that when it comes to paying their premiums, why don't we do it this way? We'll do it as if, you are my employee and I'm the benefit counselor, and I would say, Johnny, listen, before we close here, when it comes to paying your premiums for medical, dental, and vision, you have a choice. You can pay for the premiums on a post-tax basis or a pre-tax basis. So what does that mean? If you pay for your premiums on a post-tax basis, it means that the compensation dollars you used to pay the premiums for your, let's say, medical plan, will have already had state, local, and federal taxes, so income taxes, payroll taxes, taken out of your paycheck. So that way you don't owe the IRS anything, and the reason for maybe doing that is that according to the IRS guidelines, and these are not your company's rules, these are rules set by the IRS, if you pay for premiums with a post-tax dollars, you can cancel your plan anytime you want. Now, there's also a downside to paying for your medical premiums with post-tax dollars, and that is you're spending a lot of money on taxes, which is not normally done. So let's go through the math and talk about it. So if you've got $100 in premium, and we use 100 because you can do head math. You can do the calculations on their exact premium if you want, but I like doing it with $100 because we can kind of do the math in our head, and it's really easy. So Johnny, if you're paying $100 in major medical premiums on a pre-tax basis, you only have to earn $100 in compensation so you can have it deducted from your paycheck, because in a pre-tax environment, your premiums are free from state, local, and federal taxes. And they're not deferred, which means you have to pay them back later. It just means you don't have to pay them. It's the IRS guidelines again. The IRS's rule on pre-taxing is that you can enroll or modify or drop your plan only one time per year, and that's during the period of open enrollment, unless you have a qualifying event, and that is marriage or divorce, birth or death of a spouse or child, or spouse changes employment. If one of those 5 things happens, you can go to HR and you can tell Cindy Ray or Frank Cutter, and you don't have to remember their names, but you can tell HR that you had a qualifying event. You've got 30 days from that event to drop or modify the plan you're enrolled in. You cannot enroll in anything new because of a qualifying event. You can only modify or drop a plan you're currently enrolled in. So pros and cons. The positive about pre-tax is you can save about 25% of the dollars or the cost of the premium. So in other words, if you are paying $100 in pre-taxed premiums, you are saving about $25. If you're paying $200 in premiums, you're saving about $50 a month on taxes. And the only thing you have to do for that is just sign up for your plan, and just like always, you stick with it for the course of your plan year unless you have a qualifying event, and you can change. So post-tax, you pay tax dollars and you can quit any time your plan. Pre-tax, you save 25% of the premium cost every month, but you have to stick with your plan all year long. Johnny, which way would you like to pay for your premiums on your major medical, dental, and vision plans? So that's it. That's the explanation in its entirety. Now, if they ask you questions, go ahead, ask their questions, do everything you can to make sure they understand it. That's our obligation and what we want to do. So let's stop there and see if anybody has any questions about what I just ran through. So I'll be quiet for a second. Sounds like everybody's good to go. Eddie, you're on the phone with us, and yes, you're our broker. Is that satisfactory for you?
Yes, it is.
Okay.
Yeah, I mean, I don't know why anybody would want to do post-tax, but they want, they want that option out there. So,
yeah,
it is what it is. But yeah, perfect. Yeah. Thank you, Mike. Thank you for the explanation.
No worries. When I got the email from Frank, I called Jonathan and I said, dude, how do you want to handle this? Because this is kind of like, and he says, hey, look, if they want it, as long as it's legal.
Yeah. And I don't even really think it's Frank. I think it was the other lady, your
Karen?
buddy. Yeah, the one that's
Karen.
Yeah, I think she likes to hear herself talk, so I think that's all that is. But anyway.
Yeah, I think you're probably right.
Yeah, we do what they ask us to do.
Yeah, I think you're probably right. So, Andrea, I think that's all I have, and I'll just close with a thank you to everybody. We get asked to do these jobs for our brokers because we do a good job, and if you guys didn't do a good job, my phone wouldn't ring with other opportunities for all of us. So, thank you. So, Andrea, back over to you.
Thanks, Mike. Thanks. And just as an FYI, this is a PlanSource enrollment. We'll be, logging into PlanSource to do the enrollment, and it will flip you over to Harmony. And when you're in PlanSource, a screen does pull up right when you're doing medical, asking if you want to pre-tax or post-tax the premium. So PlanSource has it set up to ask that question as well. So you will not forget about asking about the taxation that they want to have on their health benefits. So we'll continue on. I've already sent to everybody. You should have already received the PlanSource directions and the zip file of the plan summaries that Eddie's office sent over. So you should have all those, and when it's time, Eddie will go over the medical, dental, vision plans for us. But right now, I just wanted to go through. There's really it's different kind of enrollment guide because most of the information is in PlanSource and there isn't a whole lot of data to capture in Harmony. So there's no, password to log in, because you'll be using the PlanSource. And PlanSource told me that they sent an email to all the benefit counselors, whether they're call center or on site. And so you should have received an email with a login and password already from PlanSource. So let me know if you have.
Andrea, if you don't mind me, does everybody on the phone, has everybody received an email already with their password?
I have not. This is Clarice Frazier.
Clarice, okay.
Okay, well, I'll ask about that. Well, I'll send an email about that in the morning time to them to state that since it's coming from PlanSource, check your spam, junk folders, because they may have gone there since it's not it's not a entity that you usually receive emails from.
I will do that.
Yeah, and when the employee calls in and they have their login, you can you'll be able to access the information through the employee as well when they're calling in, because they have their and you'll see. I'm gonna pull up later. It'll have the password and login schema for PlanSource as well. So this, like Mike's already said, this is a core enrollment, and it's all the Colonial products are post-tax, and it's a plug-in account with PlanSource. And let's see, the medical plans are through Anthem, and let's see, there's the Anthem Blue Cross Value HMO 30 plan. There was the Anthem Blue Cross Classic Prudent Buyer PPO 500 plan, and then there was the Anthem Blue Cross Prudent Buyer PPO 3500 plan, and I only saw 3 plan summaries. Are there any more plans, Eddie?
No, that's just 3.
Just those 3. And Eddie's going to tell us about those plans a little bit later. There were I saw 2 dental plans, the Cigna PPO High Plan, DPPO High Plan, and then there was a Cigna HMO, DHMO plan. Is that correct? Is there 2 dental plans, the HMO and PPO?
So it's actually going to show like it's 3 because the PPO is for the out-of-state. It's the same plan design, so it's going to show like it's separate, but it's the same one. One's for out-of-state, one's for California employees, and then you have the HMO, which is for California employees only.
Got it. And then there's a Blueview Vision through Anthem as well, a vision plan. And then they have basic life insurance policies. There's 3 classes of employees: an executive class, a manager class, and most of the employees will be under the employee class. And each class gets a differing amount. Now, only Colonial is going to be on Harmony. You're going to be logging into the PlanSource to do the core enrollment, and so all the plans are listed there with the cost. And we'll go take a look at that real quick after we get through the enrollment guide, so you can see the system. And Eddie, I couldn't think of. I don't have my usual broker instructions because there's really no paperwork or anything that we do on our end. Everything's in PlanSource. So is there any paperwork that the employees have to fill out, or they just do the enrollment on PlanSource?
Yeah, just do it on PlanSource. Everything's on PlanSource. Everything's electronically sent over, through PlanSource, and that's it. I mean, besides these core benefits and your colonial benefits, that's all. We're good.
Okay, so just so there's no extra application paperwork to do, everything's in PlanSource. So hey, yeah. My guide looks a little empty just because there's not all these extra instructions. All the rates are in PlanSource. So
yeah, the rates are in there. Everything's everything's in there.
Okay, and then and then the thing, well, call center is a little bit different, but the on-site benefit counselors, remember to have Mike's survey to get over to the employees so that they can fill out after the enrollment. Be, like we usually do, be there early so you can get set up at the appropriate time. And if you receive any phone calls from employees, log in with them, take care of what
the people that are driving to the actual Walnut location, if you GPS it, you're going to be going around in circles. When you're at one point, you're going to make a turn and cross over the railroad tracks. It's right when you cross over the railroad tracks, right away there's going to be a driveway that you're going to make a right into, and there's going to be a gate there, and you'll just call them and they'll open up for you. But just make sure, because GPS will tell you to make a right, another right, you'll be going around in circles. There's a big sign right when you pass the railroad tracks that says bulk transportation, first driveway, just go in there, and that's where the location's at. Just an FYI.
Okay. Oh, thanks, Eddie. That's always handy to have. So yeah. Rodney and Monica will be glad of those instructions. Okay, and Mike, I thought I saw, because I put up here, because Rodney's going to be on site, did Frank decide he didn't want to do group meetings? He just wanted to do one-on-one meetings?
That's
or were
correct.
You able to talk to him?
I did talk with him, and he said no group meetings. I think what's happening is they probably needed their conference room, and I don't think he understood how important that group meetings are to the employees, and he just saw it as kind of a duplication of, doing the same thing twice, which we know it's not, but, it's okay. He decided no group meetings, and we're just
I think also part of the reason, Mike, is because there's no change in their core benefits.
Okay.
I think that's another reason why.
Okay.
And it's good for you guys because it gives you a little bit more time to go over your policies too.
Yeah. Well, I mean, it'll work out. There's plenty of cases that we deal with no group meetings, like hospitals. I mean, there's just no group meetings. So we're good.
Okay.
All righty. And so now I'm going to jump over the colonial, and we'll go talk about the core because we have Eddie here for a little while. So Eddie, can you, the three different medical plans, I put a synopsis is here. Or do you want me to pull up the summaries, or what do you want me to have up?
That's fine, because it's that's what you have up here is the major benefit, the most important points on their benefits. So I can use this.
Okay.
All right. So the first plan is the only HMO plan they have. They have one HMO plan. There's no deductible on this plan. The out-of-pocket maximum for an individual is $2,500. For a family, it's $5,000. What that means is if two people have met their out-of-pocket max, that third person does not have to reach an out-of-pocket maximum. Okay. Once you've reached the out-of-pocket max, the plan covers at 100%. What goes towards your out-of-pocket max? All the co-payments that they pay out of pocket. If they pay for, when they pay their co-pays for a prescription, if they pay their doctor co-payments, anything that they pay out of pocket goes through the out-of-pocket maximum. Okay. The doctor's office, it's just a flat $30 co-payment. There is, for preventative care, There is zero copayment. Those are the yearly physical exams. Those are covered at 100%. But the actual office visit copayment is $30. Your emergency room copayment is $150. If you're treated and released that same day, they charge you $150. If you're admitted to the hospital, then they waive the $150, and then you fall into the hospital benefit. Your outpatient surgery is a flat $250 copayment. Your hospital copayment is $500 per day. And I believe, hold on, it's not on here, but let me look at my notes here. The hospital has a $500 copayment. I believe it's reading that, but let me check.
Yeah, I didn't see a maximum number of days. I figured you, when you hit your 2,500, you were done.
Yeah. Okay, 3-day copay. Okay, yeah, so it's a 3-day copay max per admission. So once, so they, the most that you would pay would be $1,500 for that hospital stay. So if you're there one night, it's just the $500, and that's it. You're done. But if you're there over 3 nights, once you've reached $2,500, you're done. Actually, I'm sorry. Once you've reached the 3 days and you've paid your $1,500, you're done. Okay. If you get hospitalized a second time, obviously you only have $1,000 to go. If you're there for more than 2 days, after those first 2 days, then you're covered at 100%. Does that make sense?
Yes.
Okay. All right. Your prescription is $5 for Tier 1 generic prescription. It's a $30 for Tier 2 on a Tier 2 brand name. And then Tier 3 is $50. Tier 2 and Tier 3 are brand name, but it depends on when the brand name falls under what tier. It can fall under Tier 2 or Tier 3. If that's the case, it's either a $30 or $50 copayment. Okay? Any questions on that plan so far? Okay. The second plan is the PPO plan. It's a 500, what they call a 530-20 plan. Their annual deductible is $500 for single, $1,500 for family. If 3 people meet the deductible, that 4th person does not have to meet a deductible. Okay, and this is a annual deductible. The out-of-pocket max is $4,000 for an individual, $8,000 per family. Their office visit copayment is $30, and they waive the deductible for regular routine visits. Now, this also for preventative care on this plan, in-network is covered at 100%. They do not have coverage at a network on a preventative care visit. Okay? The emergency room copayment is $150. Then they pay 20%. Blue Cross pays $80. But remember, the out-of-pocket max is $2,500, so they'll never have to go over those $2,500. Outpatient surgery, outpatient surgery is 20% after the deductible, the $500 deductible. Hospital is the same thing, 20% after the $500 deductible. And then the prescriptions, the same thing. Tier 1, which is generic, is $5. Tier 2 is $30, and then Tier 3 is $50. Those are brand name tiers. Any questions so far? All right. The third plan, this is where most of the employees are enrolled on. This is the Solutions PPO, which is it's got a pretty high copayment. Deductible. It's a $3,500 deductible, and it's a $7,000 family deductible. The out-of-pocket max for an individual is $63.50. I'm sorry, those numbers are pretty small. For family, it's $12,700. And they're not small. It's just probably me. I'm getting old. I can't see as good anymore. The office visit copayment is $30, and they also waive the deductible on the office visit. for this plan. And for preventative care, is the same thing. It's covered at 100% in-network. Out of network, there's no coverage. And you will see on the plan designs that I sent over, each benefit, if they waive the deductible, apply to that. For generic, it's $40 for Tier 2 brand name and $60 for Tier 3 brand name. Okay, any questions? Okay, so that takes care of the medical. The vision is a little different on this one. It's also with Anthem Blue Cross. You get an eye exam every 12 months at a $25 copayment. Your frames are every 2 years, and they give you a $130 allowance. What does this mean? If the frame is, let's say, $200, Blue Cross will pay the first $130, and that's $70 that's left over. That's the patient responsibility. Okay. Your lenses are also every 24 months, and you have a $25 copayment for lenses. Regardless of the type of lens, it can be single vision, bifocal, or trifocal. You're only going to have a $25 copayment. If you want contact lenses in lieu of glasses, it's also covered at every 24 months, and they give you a $130 frame allowance. So a lot of people get confused with this benefit. A lot of people say, hey, you know what, I can get glasses and a pair of contact lenses. No, you have to elect either one. You can only have coverage for either eyeglasses or contact lenses.
Got it.
All right. Now, the Blueview Vision does have out-of-network benefits. So if you go to an out-of-network provider, I wouldn't recommend it. And you'll see the plan design. Those are all reimbursement amounts. So you'll see on the actual plan design to the right, it's going to have out-of-network benefits, and it's going to have dollar amounts. What employees do is if they go out-of-network, they will get reimbursed up to those amounts. And what they do is they pay out of pocket first, and then submit a claim to Blue Cross, to Anthem Blue Cross, and they get reimbursed up to those amounts.
Here
There
it
you
is.
go.
Come on out here. Don't hide. There we go.
All right, so does everybody see where it says in-network, and to the right it says out-of-network, where it says $49 allowance? So if I was having an exam here, if I went in-network, I just pay $25 and it's covered in full. If I go out-of-network, I pay the full amount, submit a claim to Anthem, and then Anthem's going to reimburse me up to $49. So if it's $100 that I pay out of pocket, they're only going to give me $49. Okay,
Yep.
And so all those amounts to the right is what they will reimburse you. And then it has extras if you go down the line. I mean, the benefits I went over are just, you know, the main benefits. But, you know, obviously when you select a pair of glasses, you know, they'll ask you, hey, you want UV coating, you want tint, you want this. So you have co-payments on there, and you see the co-payments to the right of each one.
Yeah, that's nice.
Okay.
Okay.
All right.
Alrighty, back to our, and then the dental. I think I just had the.
Yeah, so there's two plans. Well, actually, that dental choice. Andrea sent you the HMO plan design earlier today. So
She did.
So these two plans, if you look at the benefits, they're the same. The only thing is one of them, the Cigna PPO High plan, that's for California, and the Cigna Dental Choice High plan is for out of state, so they're going to be the same thing. So I wouldn't worry about, trying to find out the difference between these two plans because they're the exact same amounts.
So this is, whoops, here we go. Here's so this one is California, the high plan is California, and the other one is out of
The other
state.
one's out of state, correct. I
Out
don't know
of
why
state,
they do it.
but-
I don't know why they do it this way, but that's how they separate them, and that's how, So anyway, so the PPO dental, it's got a calendar year max of $1,500. That means that Cigna will pay $1,500 per calendar year for services. Okay, that's all they're going to pay. After they've reached the $1,500, employees are on their own. Their annual deductible is $50 individual and $150 for family. That's only going to apply when you use the basic and major services. You're going to have to pay a deductible. When you go to class 1, which is preventative and diagnostic services, that's covered at 100%, and they waive the annual deductible. Okay, that's when an employee goes for routine teeth cleaning, routine X-rays. Remember, the employees will always ask, and I go through this all the time, and you've probably gone through it before. They get confused with basic cleaning and deep cleaning. Okay, deep cleaning is totally different. That is not covered at 100%. The basic cleaning is covered at 100%. Okay, your basic services, you're covered at 80% plus a deductible. For major services, you're covered at 50% plus the deductible. The benefit design will tell you which benefits are under Class 1, Class 2, and Class 3. And it's pretty simple. I mean, you'll see it when you have the actual benefit design open. Okay. Remember, these plans do have, here you go. Thank you, Andrea. So this PPO plan does have in-network and out-of-network benefits. And you're going to see, for example, for Class 1, if you see the in-network and out-of-network, it pays the same, but it's confusing because in-network, it means the dentist is contracted, so you're actually paying a percentage of contracted rates. When you go out-of-network, there's no contract, so you're basically paying, they're paying 100% of what they feel the rate should be. So what that means is that the dentist is charging you $1,000, but if Cigna says, well, our contracted rate, we're only going to pay $250, you would have to pay the difference, the percent, so that's how that works. Does that make sense?
Yeah.
Okay.
Yeah, so it's 100% of this contracted fee, and whatever the dentist charged out of network, that's over that contracted fee.
Correct.
The employee's going to have to pay the rest of it.
Correct. Yeah, so that's why people get confused because they, wow, I can go to a network and they pay the same. No, it's not going to be the same because paying, a contracted rate and just paying what the dentist wants to charge, it's totally different. Okay.
Okay.
So that's it on that plan. Orthodontia, if you go all the way to the bottom, they do cover ortho, and they have a lifetime maximum of $1,500. So they'll pay 50% to a maximum of $1,500 lifetime. What this means, that's it. That's all you get, $1,500 for ortho. It doesn't read like with the annual maximum where it's per calendar year. This is lifetime maximum, which means that's all they're going to pay. It's $1,500.
Got it.
And they cover ortho for dependent children to the age of 19.